what I had planned was to discuss the ginger oil type, and then to go over with those people who were there, at least to share some of their experiences with the projection that we had a couple of days ago. So I think what I'll do is because we're short on time, I will go over the ginger oil type. Let's go through some of that. The reason for this is not so much that I expect you to remember the ginger oil type in any detail or anything of that nature. It's basically just to show you how to read Materia Medica, how to go through Materia Medica, and how to, who is the ginger oil type, how you knit the pieces in the chapter together, and how you figure that out. So the same would be true if I had demonstrated any other chapter tonight. It'd be the same thing. So I'm not picking ginger oil for any other reason other than I've covered ginger as an herbal medicine recently. So I decided, well, why not? Let's do the ginger oil type. So if you could just hang on 1 second here, I'm just going to get a little bit more ventilation in this room. Okay, so here we are. So let's take a look at ginger. Okay, so basically, we started this when we were going over it as an herbal medicine. And once again, I want to review, well, how do you use a chapter? Because one of the things that I emphasize many times to students, especially new students, is that you don't try to memorize much of anything. You will remember a few things. In other words, certain things will just be remembered, will stand out to you, and you will remember it, but you're not trying to remember anything. Whatever settles into your head is what will lead you to the oil. The few things that will come naturally to you will lead you to that oil, or will announce it to you in some way. The rest of it depends upon your ability to use the references. Knowing how to use the chapters and knowing how to use the repertory, how to use the 6-element reference guide, and all the other reference guides that there are in SPE. So one of the things you look at here when you go into a chapter, and I'm going up there now, is this opening section. This is basically a summary of everything that's in the chapter. So we see the miasm, which I will go into tonight. We see the vessels of the tree of life, which in Hebrew is sefirot. It means vessel, essentially. We see the constitutional type, which we will not be going into tonight. And then we see all the core perspectives, which is essentially what are all the subtitles in order as they occur in the chapter. So if I'm looking for something in particular, I can see approximately where it is in the chapter. So if I want to learn about the miasm, we can see it's pretty close to the end of the chapter. On the other hand, if we want to see, well, what does ginger have to do with, for instance, the small intestine, then we can see it's in the middle. So one of the first things you look at in a chapter is going to be the signatures, the plant signatures. And one of the first things we look at with a plant signature are going to be the leaves. Now, the leaves in this case have this blade look, similar to the blade on a spear. So this tells us right away that there's some animal energy, animal soul energy in this particular plant, more so than if this was a heart-shaped leaf. Now, if you look down here at the tuber, the root, so to speak, you can see what looks like antlers sticking up out of here. And basically, here's the actual root down here. This is actually a tuber. Ginger is an underground stem. And you can see these projections, and this is what gives ginger its name, are those antler-like projections, in Latin, that is. Now, other oils that are in the ginger family include cardamom, galangal, and turmeric. Turmeric is a form of ginger. We also have ply in SPE, which is a wild ginger from Thailand. So basically, there are some crossovers between these and SPE, but they're still treated absolutely separately as totally different oils. Now let's move on to some of the other things to look at. So here, the word lanceolate in relation to a leaf means lance-shaped. And then we see down here is that the rhizome, the underground stem, is club-like. It has a dense spike on a stem. So everything you see here, the description is pointing more and more to this animal soul, although it is balanced out with some of this, the colors of the flower, the pink flowers on some of the varieties, and so forth, which tells you it also has more of a plant soul, more of that etheric body. Here's a good picture of the flowers in close-up. And we can see they do have this type of softness about them with the pink at the edge, which is going to take you to heart chakra, the element of love, and so forth. And of course, the flower is the sexual organ of the plant. So this tells you something about the ginger oil individual on that level. Whereas the leaves on a plant have a lot to do with feeling and reaching out, how you reach out. So the ginger oil individual is paradoxical, is that there is a degree of timidity and shyness in the individual, but there is that in the emotional frame. There's also going to be some of that, animalistic quality, not in terms of violence, but in terms of maybe territoriality or taking things personally, or reacting in a way that's a bit more conflict oriented than would be ideal. Now, when we go to, and let's just take a look at one more picture here. This basically looks like I did the same picture twice. This is another variety of ginger. You can see there are different flowers on ginger. So if you really know which variety you're working with, and I don't get into it on that level, and you know it has the red flowers as opposed to the white flowers, this does have quite a bit of pink in it, but there is more red. So I would say that this would be a bit more towards the fire element. There's more fire in this, perhaps in the sexual range as well. And here again, we just see some pictures here of what the actual tuber looks like. Now, one of the things we know about ginger is that it's a rich source of nutrition. This rich source of nutrition, as opposed to some of the oils, are not from edible parts of the plant. They're not particularly rich source of nutrients. So there are some that are actually foods that are very rich in nutrients. So this tells you there is the theme of nurturing. So this will bring in this counterbalance once again to the more animal or astral body end of it, to more of the etheric, maternal, nurturing, soft side. And this soft side will be experienced on the stomach level, which will tell you that involves earth element. Now, if we go to the aromatherapy, well, first we know that it's a very, very strong digestive. Anything that's very strong in the digestive range is going to be earth element. This will be stomach, and to a certain extent, it's also going to be pancreas. This already tells you that nurturing is involved. Nurturing, the theme of nurturing is going to be associated with two parts in the human being. One is going to be the breast, and the other is going to be the stomach. When you see stomach issues that are constitutional, that have been around a long time, and the person has certain qualities, one of the first questions you're going to ask in terms of their history is, well, what was your mother like? Were you sufficiently nurtured? Do you feel nurtured? Do you self-nurture? And so forth. Now, we went over most of the actions as a medicine of ginger, so I'm not going to review that now. But Interestingly here, ginger is in Chinese medicine, ginger is considered to be a yang remedy. Now, yang would be on the animal side of things. Yin would be more on the plant side, the plant soul, the yin receiving soul. The yang is the more outgoing soul. And it's supportive of the spleen, which in Chinese medicine, spleen means spleen and pancreas, the stomach, and the kidneys. Ginger is an important remedy for the adrenal glands. So if you're making teas for yourself, you will want to add ginger in if you're wanting to do something to support your adrenal glands. So this is just my discussion of yin and yang, and now let's get over to the aromatherapy. And here's the spleen meridian, kidney meridian, stomach meridian. The stomach meridian is interesting. It's an interesting thing to bear in mind, is because we can see where the stomach meridian actually ends. It ends right up here to the upper edge, outer edge of the forehead, right into the hairline over here. So this is an interesting way of understanding how what you eat is going to affect your brain. So if the stomach meridian becomes corrupted, then it will have an impact not only on the stomach, but on the entire body, including the brain. It's also a major remedy for the sinuses, as you can see right over here, and for TMJ. So this is stomach 6 down here, which is major, and that's stomach 7 right there for treating TMJ. Stomach 5 as well to a certain extent, and stomach 4 next to the lips over here on this side. These are all important TMJ points. So often, the TMJ is going to be related to stomach issues. If the stomach is filling with gases, especially if it's pushing up against the diaphragm and causing pressure in the system, you will sometimes see almost immediately a reaction in the jaw joint. I had a client who had a very interesting phenomenon occur in that she was a wine drinker, and she was able to drink wine for years and years. But then it got to a point that every time she drank the wine, as soon as the wine got into her stomach, she had TMJ. So there was a direct connection between the stomach and the manifestation of the TMJ symptoms. By the way, the cannabis salve, which I will try to discuss for 5 minutes today and go into detail about that next time, is something that I just created about a month or so ago. And it is absolutely excellent for TMJ. So if any of you suffer from that, then I'm finding that with just one application of it, within minutes, the TMJ pain disappears. And if you use it regularly, you can control the TMJ pain completely. Okay, now getting past the herbal medicine, let's get to the aromatherapy, and let's read the aromatherapy. This is an interesting thing to remember here, by the way, that ginger exerts a tonic effect upon the heart. So if you're looking for, wanting to put together some type of not just a tea, but in terms of the oils to treat heart, high blood pressure, stickiness of the blood platelets, elevated serum cholesterol, then ginger is one of those oils you're going to be thinking about, one of the primary oils. It also helps counter liver toxicity. So if you're concerned, well, what do I do, for buildup of toxins in my liver? One of the things that I'm dealing with some of the folks that I know is liver toxicity as a result of COVID. In some cases, it's due to the COVID itself. In other cases, it's due to the so-called vaccine. So you're maybe wanting to think, well, what do I do about that? Because especially when you're running into long COVID, where people develop symptoms of COVID and they never go away. They're basically exhausted. They continue to have respiratory symptoms and other types of diverse symptoms. Where do you actually work? And I will go into that in detail 2 classes from now, definitely not the next class. In about 2 classes, I will go in detail with that and tell you where you need to work. And there are basically three places you need to work. The first place is the mitochondria. You need to support the mitochondria of the cells. A lot of the damage in these cases is due to damage to the mitochondria. Now, there was a study that came out early in the COVID pandemic that was completely ignored by conventional medicine because it wasn't part of their narrative. They were saying that that the whole problem was in the lungs, and that what you needed to do was really get in there and treat the lungs because of the cytokine storm and on and on. And of course, it would affect the lungs. But this is Israeli study, which was done in an Israeli hospital, determined that the first effect was that the mitochondria in the red blood cells was affected, and that one of the most significant ways to prevent yourself from having any damage from COVID beyond some mild flu symptoms, if you manage to get it through transmission, was antioxidants, and specific antioxidants that protect the mitochondria of the red blood cells. So your question may be, well, what are some of those things? Well, one of the most important ones is CoQ10. And CoQ10 was one, which there are 2 different forms of CoQ10. The one I recommend is called ubiquinol. And this is one of the most important nutrients you can use to protect the mitochondria. The other one is NAC, N-acetylcysteine. So N-acetylcysteine is converted in the body into L-glutathione. And L-glutathione is an antioxidant produced by the cells themselves to protect all the cells, including the red blood cells. So now let's move to, once again, down to the aromatherapy. By the way, the other places aside from the mitochondria are going to be the liver and the adrenal glands. The adrenal glands take a big hit from COVID. And so you really need to know how to support the adrenal glands. One of the herbs that I've been using a lot, well, ginger is one of them, by the way. But one of them is, there's 3 to remember that I use a lot in that particular case. One is Siberian ginseng, which is not the same thing as ginseng. It's not really ginseng, but it's called Siberian ginseng. Another one is a mushroom called cordyceps, and I use a mushroom extract, a cordyceps extract. And the third one is an Indian herb called ashwagandha. So I'll use those in combination with ginger, and I will add NAC into that. Now, moving on. Finally, we're here at the essential oil, and this is something that I've discussed before. When you read the aromatherapy, Materia Medica, for a specific oil, don't go in and cherry pick it and look, okay, it's for this, it's for that, it's for this. You're not going to remember a thing. You're just wasting your time. So many of the oils are relevant for the same things that it's meaningless to think in those terms. What you want to do is think in terms of the picture. Read the picture, read this essential oil symptom picture like you're reading a biography. So if you read it like it's just one long narrative rather than a listing of symptoms, you start to get a feeling for it. So and that's the important thing. The important thing is the feeling. What am I feeling from this? So I'll just read it that way. Depression, emotional stress, restlessness, apathy, feeling of estrangement, anxiety, hypersensitivity, fatigue, nervous and or physical exhaustion, debility, dull senses, poor circulation. You take all of those together in composite, cumulative, and you're beginning to feel the failed state of the ginger oil individual. So let me explain what I mean by the failed state. Every individual is going to, as a deeper person and as an individual navigating through society, has a success state or a failed state. Now, in the success state, everything's going okay. the individual is feeling well, the job is going okay, life is going okay, whatever they're doing, whatever the whole scenario they've built for themselves, the outer persona that they've developed, the skill set they've decided to accumulate, this individual has decided to take as a partner. It's all going on. It's all working. It's going okay. That's the success state. Now, on the other hand, traumas may occur. The job may be lost. The marriage is not going all that well. The profession that this individual chose is now really not in that much demand as much. Money is an issue. All of a sudden now, developing circulatory issues, starting to become very hypersensitive because of the anxiety. They're starting to feel estranged from everything. They're becoming very restless and depressed. Eventually, depression leads to a type of apathy. And now they're becoming more and more exhausted. This is your failed state. So the person is going from the success state to the failed state. Now, if you're going to say, well, how do I know the success state? Because the chapter is emphasizing the failed state. Because let's face it, the people who are coming for any type of therapies, they want to change in some way. They don't feel they're in a success state, especially for spiritual PhytoEssencing type of blends. They need something. Well, if you go through the chapter, you begin to understand what a success state would look like. So this is basically what you would do is you can do a reverse image of everything. Everything that they're talking about that ginger is useful for on an herbal therapy or herbal medicine level tells you something. Well, they'll have a strong stomach and a strong pancreas, and their kidneys are strong. That will tell you what the success state looks like. So essentially, that medicine, because ginger is specific for that particular success state, will then be very relevant for the failed state to restore that particular success state. Now, if you look at the physicals, because you want to look at the physicals, but you want to look at the physicals in a way that you don't get lost in the weeds. Because of these 50 physicals that are listed here, this individual is only going to have 4 or 5 or 6 of those. So you can't look at it this way. You can't look, oh, let's see here. It's for yellow fever. No, she doesn't have yellow fever. She's not dizzy and she doesn't have a toothache. So I don't know. No, that's not how this works. The way this works is you get a feeling for the type of physical symptoms, the type of physical individual that you're looking at here. So we see, for instance, if you look through here, in this particular group, this first group, chills, fever, malaria, yellow fever. So they have a tendency towards fever. So the person will report to you, I get fevers every once in a while, especially when I get tired. If I'm really tired, I'll get a fever, or if I'm in a lot of pain. Some people will spike fevers if they have pain. So I go, okay, well, fevers, she did mention, that she gets fevers. Then some things may show up like dizziness and so forth specifically, but then you're looking here, tonsillitis, sore throat, respiratory infections, cold, flu, spasmodic cough. There's a lot of respiratory in here. And she does have asthma, or she has chronic bronchitis, or now she's getting older, she's got COPD, or she reported as a child she had a lot of recurring bronchitis, and the mother took her to the doctor and he gave her antibiotics, and ever since then she's been a real mess on this level and that level. Then we look towards the biggie that you're really looking for in ginger is all of these digestive symptoms. There's a lot of digestive symptoms. Does this person have digestive issues? If they don't, to be quite frank, I'm starting to lean away from ginger. I would find it hard to believe that the ginger individual does not have any, has a lot of these particular emotional type symptoms, but doesn't have anything physical on the digestive level, I would think it's time to look at another oil at that point. So you're looking at poor appetite, anorexia, dyspepsia, flatulence, nausea. And the important thing right here with this, by the way, when you're looking at that, those symptoms, is one of the first things that should jump into your mind if you're working with anybody else is cancer. Not the angina, by the way. That was a mistake, highlighting that. The poor appetite, the anorexia. Anorexia is not anorexia nervosa. Anorexia just means no desire to eat. Dyspepsia, which means indigestion, flatulence, and of course, one of the biggies, nausea. So this starts to bring to mind, well, can I use this in chemotherapy? And the answer is absolutely. You can use this in chemotherapy. This is one of your go-to remedies, would be the ginger as not only as ginger oil to be rubbed in externally, but ginger, the herb, should be used on a regular basis, especially if there's respiratory symptoms as well. Perhaps they're being treated for some type of a respiratory cancer. But this is post-chemo, I would definitely use this. Also consider this in morning sickness. So with pregnant women, one of the things that I've done a lot of over the years was a combination of raspberry leaf tea mixed with ginger tea. Raspberry leaf tea prepares the uterus for birth, and the ginger tea will help with the digestive symptoms. Motion sickness for little kids who have to sit in the front seat of the car when you're driving and so forth. Ginger would be a very good oil to diffuse into the car with a little bit of one of those little diffusers that you plug into the cigarette lighter, and so forth. So you're seeing here that there's a lot of digestive issues here. There is a lot of, and diarrhea, colic, and hangover and motion sickness will all go into the digestive end of things. And then you see there's a lot of sexual symptoms in here, but it's mostly sexual weakness, impotence, premature ejaculation, frigidity, deficiency of yang, fire, irregular menstruation, dysmenorrhea, which means cramping pains. And then we see there's a lot of musculoskeletal issues as well. Right here, as you can see, going all the way down to here, we have these arthritis, rheumatism, low back pain, muscle aches, sprains. And so we see that ginger oil would be useful for those people who complain a lot about, oh, my back and my knees, and I had to have a hip replacement. And at the same time, they have all these emotions, most of these emotionals, or a lot of these emotionals, and they have digestive symptoms. Now, it doesn't really matter what those digestive symptoms are. It doesn't really matter what the musculoskeletal ones are. The big ones would be if this feeling comes up here from the emotional range, but we see they do have physicals that fall into these categories. Now let's go to on a psychospiritual level, ginger is thought to be simultaneously uplifting and grounding and warming to the emotions. It renews romantic interest and aids memory. So this goes into, if you really knit this together, you can start to see some of this here. So you can see this sort of yang right here, because it is a stimulant, an herbal stimulant, but yet it's grounding, earth element. It's warming to the emotion, fire element, warming to the emotions. It renews romantic interest, which may help with the impotence and the frigidity up here that we see, if these have emotional roots to them. It's not a physical issue that's causing this. And it aids memory, and this will bring us back to the blood circulation. Ginger is good for supporting blood circulation, and at the same time, it connects back to what I was mentioning earlier about how the stomach meridian ends all the way up right by the brain. And then it goes on to say it encourages inspiration, enlightenment, replacement of continued futile struggle, and knowing and acceptance of transformation. Now, I came pretty late to today's class, and I will finish this discussion in large part the next time, or some that I'm going to leave out. But what I'm going to do now is I'm going to skip all the way over to the Cancer miasm. So let's see if I can find that little box so I don't have to scroll through this whole thing here. And you can see this is a big chapter. Now, of course, you can never remember anything resembling this chapter. It's here for you to make sure it's the right oil. Okay, I looked at the aromatherapy, I looked at the herbal medicine, I'm still not convinced. I don't know for sure. Let me take a look at some of these other sections here. Go, and you'll hit a section like the earth element in the stomach and the pancreas, and you go, yeah, okay, that's starting to make sense. And then you go to the next one, till finally you have it. Okay, that's enough. I've got it. Or you read 2 or 3 sections, and you go, I don't know. I'm still not feeling it. That's good enough. It's time to leave the chapter. You don't have to read all 12 sections in the chapter and try to convince yourself. Once you've been through the aromatherapy and the plant signatures, the folkloric history, that type of thing, maybe the gemstone essence, then it's, or the gemstone, I should say, the gemstone associated with it. You look at a couple of sections. If it's not really resonating with you after another couple of sections, it's gone. Don't even bother with it. It should hit by that time. Let's go over miasms very quickly, and I'm going to end this discussion here in about by 5:15 for me, and I'm going to do a half an hour reports for those people. Hopefully, there's a few here that actually participated on Sunday, and I'd like to hear some of your feedback. So ginger oil is a strong affinity for the cancer miasm, one of your major cancer miasm oils. And this, of course, increases its relevance in terms of cancer. Not that everybody with cancer miasm will get cancer. Remember, most people won't. But nevertheless, the fact that it's associated with the cancer miasm, it increases its visibility for you as an oil to use with somebody who actually does have cancer. So let's talk about what a miasm is. Now, I've gone over this various times, and I'll go over it very briefly. The idea of miasm, the concept of miasm, was developed by the first homeopath, the person who founded and created the art of homeopathy, Samuel Hahnemann, around 1810, 1815, somewhere in that range. And he was a medical doctor, and they were using very powerful, heavy metals and terrible poisons, putting manure on wounds and doing all kinds of awful things. And he got very disenchanted with modern medicine. But he decided, maybe there is a way to use some of these things, like the mercury, for instance, to treat syphilis and so forth. But what if I dilute it, and give it just the smallest amount possible that'll elicit a response? And he did that. And it turns out it wasn't like, just a few milligrams or whatever. It was 1 part in every 10,000, 1 part in every million was enough to elicit a response. And so he started treating various diseases, and he had fairly good success with acutes, like the flu and typhoid fever, things of that nature. But with chronic ailments like arthritis and chronic heart disease, chronic lung ailments, he had no success at all. His cases just failed. So he decided he needed to come up with an idea as to why. Why is it not working for chronic diseases, deeply seated diseases? And his answer is that there are miasms, which are basically, think of them as like curtains or invisible walls that are blocking entry into the case. So what are these invisible walls? What are these curtains that are shutting the action of the medicine off from the symptoms? Well, he says it's something that's inherited from the prior generations. So what would those things be? Well, if it's the syphilitic miasm, the father, the mother, the grandmother, the grandfather had syphilis prior to the conception of the next generation, prior to the conception. It can't be that the father had syphilis after the child was born. It had to be that the father had syphilis or the mother had syphilis before the child was born, and so forth. It transfers. And a person who has syphilis reacts in a very specific way, emotionally and physically, because they have syphilis, and it causes all kinds of physical symptoms and emotional symptoms. And so when the child is born, they're not born with syphilis, but what this individual is born with is the reactional mode, the way of reacting physically, the propensity to have certain types of symptoms, and the propensity to have certain types of emotional reactions and reactional modes or emotional symptoms. Well, he said it came just from diseases that the prior generation or even a generation prior to that had. Well, in SPE, it's thought to be also something that comes from past lives. That, let's say you, for instance, in a past life had tuberculosis and you died in 1828 of tuberculosis. That propensity of how a tubercular individual reacts physically and reacts emotionally is passed along from one generation to the next. Remember, you have had to have that tuberculosis before you gave birth to the child. Can't be, oh, the kids are grown up, now I have tuberculosis. That's meaningless in terms of miasms. But in transferring a miasm, it has to be prior to conception of the next generation. Now, this can go back one past life, 100 past lives, who knows? I don't know. But in SPE, it's considered that you're bringing that along with you, as well as you can inherit it from prior generations of your family in some non-genetic mechanism. There's a transference, it's not genetically, some energetics that's transferred in a way that's not understood in conventional medicine. So one of these is cancer. Now, Hahnemann didn't come up with cancer miasm. This has come up much later. 20th century homeopaths developed the idea of the cancer miasm. So let's say your grandmother had cancer before she gave birth to your father. And she had the various characteristics of somebody who has cancer, especially if it's not going all that well. And so you see two major themes in the cancer miasm. Everything is so out of control. Think metastasis. I need to bring things under control again, or I will be destroyed, which is the major idea anybody with cancer has. I got to get this thing under control. It's going to kill me. There is chaos, a sense of breaking away, and I can do nothing. Life is changing now. The success state has now disappeared. There's a sense of everything breaking away. Everybody else is normal. Everybody else is going about their lives. The dog is still out in the backyard, digging holes. The kids are still going off to school. But your life seems to be breaking away from them. And you seem to be helpless, especially if you're in the medical system. It's all up to them. They're doing the blood work, whatever they see, they come up, they're giving you this, they're giving you that. And you have nothing really to say about your treatment at all. You can do some things on your own, but they often discourage you from, oh no, it may interfere with the chemo, which of course is really nonsense, but we won't go into that tonight. Now, the other major theme involves the inability to develop a sense of individuality. Those who prominently feature the cancer miasm manifest a malignant inability to differentiate themselves from other people. It cannot or do not allow individuality to be expressed. This is one of the major issues you run into when you're doing custom blends for people who come to you for a custom blend is this. That's why you see so much cancer miasm among the individuals you're going to be making blends for. This correlates to cancer in a very specific way. What is the difference? Let's take, for instance, a lung cancer. What's the difference between a normal lung cell and a cancerous lung cell? Well, cells don't live forever in the body. Some of them live only a couple of days. Like skin cells can live just a few days. Then they're sloughed off and new skin cells push up from underneath and the old ones are sloughed off. Some cells will last a week, some a month, some longer. But there has to be some way that this cell reproduces itself before it leaves, dies, or leaves the body. And that's called mitosis or cloning. They're cloning themselves. They're making an exact replica using the DNA within the nucleus and the mitochondria of the cell, the DNA and the RNA, the genetic material, to make an exact replica of themselves. And if that exact replica turns out to be exact, it's a normal cell. It's the lung cell now replaced by the next generation of exactly the same lung cell, performing exactly the same function in the lungs. But what if it doesn't come out to be a perfect clone? What if instead of 100% clone perfection, it's just, 75%? That's a cancer cell. 75%, that's a pretty treatable cancer. But what if it's only 20%? That's a problem. That's one of the metrics that a pathologist is going to use when he or she is looking in the microscope at a tissue slice, is to look in there and say, well, wow, those cells aren't individualizing very well at all. I'm going to stage this cancer at such and such, more advanced than one that, it's pretty close. Let's watch it for a while. It's not that bad. Maybe it'll revert. Maybe we'll do mild treatment. We'll just cut the tumor out, but we're not going to go ahead and do chemo. We can take more of a wait and see, more of a cautious approach. Whereas especially if it looks like there's even one lymph node positive and the level of differentiation of the cells is very low, then they're going to go at it with tongs and hammers. Then they're going to recommend, everything, chemo, radiation, whatever is relevant. They're going to go after it in that way. So that's what happens with the cancer myasm individual. Instead of being able to individualize, let's say this individual, let's call the individual, let me try to think of a name that nobody in this class has. I can't think of one offhand. I don't know all the names in my head. But let's say Hortense. I'm sure there's no Hortense. Let's say Hortense has to be Hortense, Hortense really is, what her true self is. But instead, she has a malignant inability to differentiate into being Hortense. Instead, she doesn't allow that individually to be expressed because it's not accepted by other people. They want Hortense to be there for them, to do what they want, to eat what they eat, to like what they like, to dress like what they want her to dress, to study what they want her to study, to be an accountant rather than an artist, to be this, to be that. She is not developing a sense of individuality. You put this together with the sense of everything is going out of control, which is likely to happen if you can't develop your own sense of individuality. You're operating from your peripheries rather than from your center, and it's very difficult to control your life from the periphery. You can only control it from where you are totally grounded and centered, and that is your real self, that part of yourself which never loses its connection with your soul, your individual drop of the divine light. So ginger is one of these oils that is specific for individuals who manifest the cancer miasm. And in the history, this begins to come out. Now, where we'll pick this up, because we're running low on time here, where we'll pick this up the next time is, well, I will demonstrate to you what in this chapter gives you the understanding that the ginger individual is in fact a cancer miasm type. So you begin to see how that works. And I will finish, just as an introduction to Kabbalah, I will finish with that section in the chapter, because that is the culminating section in the chapter. That's the one that takes all the streams of all these sections that precede it and takes all of it and correlates it with vessels of the tree of life and tells you, aha, here is the ginger individual. And I will say for next time who the ginger individual is. So I'll at least get two. So tonight, my agenda is I'm going to complete my discussion of the ginger oil individual and use that as sort of a pretext for discussing once again what are miasms, what are archetypes, what are archetypal images, what are we trying to do when we're blending, what does it mean if you're a ginger oil type? Does that mean, that's the oil you're going to use ginger? And the answer is no, it doesn't mean that. It means that it's one piece of your puzzle of who you are. It's not all the pieces. There are other oils that are the other pieces. And then when you put all those pieces together, then you have your portrait in oils. So let's go ahead and take a look at that. From there, we're going to move on to introduction to the lymphatic system, which is going to be a focus for the next couple of months. We'll focus on that. And if we have time, which I'm hoping we do have some time, I'm going to go ahead and go over the cannabis pain relief salve formula. You will be receiving it by email tomorrow. I will send it out, but I thought, I'll go over all the details so that there are no questions on how to make this salve. It's really a wonderful salve. So let's go ahead and start off with ginger. And let's see. Here it is. So rather than just jumping right back in with ginger, let's once again review is because, it doesn't hurt to review. I know for some of you, this is territory we've gone over sometimes, but if you go over it until you really incorporate it into your understanding, your global understanding of spiritual phytoessencing work, you'll have a much better understanding of what you're doing and what you're attempting to accomplish. So before we get into the eye and the other things we'll be discussing here, I just want to mention something that you should know. And that is when you're a spiritual phytoessencing blender, your goal is not to, when you're doing a customized blend like this. Now, I should say there's a difference between a custom constitutional blend, which is what I'm discussing tonight, are the custom constitutional blends, and the spiritual phytoessencing situational blends. In situational blends, you do have a very specific target. So, for instance, let's say you have a client or somebody you're working with, and they've been doing very well, but as things go in life, they've had some type of a stress. Let's say somebody close to them has passed away. So now they're in grief, and you don't want their journey to be lost, which is normally what happens when people hit periods of stress, of strong stress, is they drop their journey towards wholeness of being that they've been proceeding on, with the rationale that, hey, I can't pay attention to that now. I'm going through this. This is what is real. When the ideal in spiritual phytoessencing is that you don't lose track of yourself no matter what happens. So whatever you're experiencing becomes part of your understanding and your acceptance and your ability to evolve through that, rather than that being some type of a fence that blocks further progress along your road. So your job as a blender at that point is to create a situational blend to help this individual. Let's again use the example of grief, to help this individual work with the grief, to understand the grief, to experience it. Because you have to experience it. In some way, grief can be compared on a physical level to inflammation, in that inflammation is a normal part of immunological function. You need inflammation in order to accomplish certain things that the immune system is trying to accomplish. But when it continues for too long, or let's see here, when it continues for too long, it becomes part of the problem. It should have a limited lifespan, the inflammatory process, to help with the healing. It perfuses more blood into an area, brings more oxygen to that area, brings more white blood cells and so forth to do the healing and the repair of the tissues and to remove the damaged cells from the area and so forth, destroy bacteria, whatever is going on. But then if it continues too long, the inflammatory process becomes part of the problem and can turn something from an acute process into a chronic disease. But nevertheless, it starts out as healing, even though it may have pain associated with it. Now, grieving has its place. It's sort of an inflammatory process where you needed to work through the loss of this individual to review your experience with them and your life and where your life is going, all the things that go on during the grief period. But if it continues too long, it becomes a problem. You have to move on. Ultimately, you need to move on. So basically, you will do a blend in these cases to assist the person to help with the grieving process, their understanding, to connect them in spirit in some way with the person who has passed, maybe assist that spirit connection between the two, so there isn't this complete sense of loss that is taking place. There is some sense of a possibility, a potential for a new level of relationship with that individual, if that is so desired. But at the same time, it builds the road towards understanding, acceptance, and letting go. So you do the situational blend to help with that particular acute process, but at the same time, it becomes part of a tributary into the stream of their journey towards wholeness of being. So that's a situational blend where your target is a very specific thing, in this case, to help assuage the grief that the person is experiencing. But a custom blend has no targets. You have no target in a custom constitutional blend. What you're attempting to do in a custom constitutional blend is one thing: to mirror image who this person truly is on a true self, real self, soul level. Your job is to be an artist, a painter, painting a portrait as accurately as you can of this individual. With the idea being that if this individual can see their true, let's just say her, if she can perceive her true self for the first time in many years, maybe decades, in this blend, she can perceive it through this transduction from the blend into some type of a 360-degree experience on a soul level, then this will enable her to shift out of the state of stuckness that she has been in and pursue the only pathway out, the only escape from that stuckness, which is to be real, to be with herself and to experience the growth and the evolution on a soul level that ramifies from that. So your job is to do the best you can as an artist to paint that portrait. Now, you're not saying, oh, well, she's got a bad marriage. She doesn't like the job she's in. The kids are giving her trouble. One of them is a real problem. He should be out of the house by now. He's 32 and still sleeping on the couch. None of that is your business. None of that is your job. Your job is purely to paint the portrait. Because if that portrait is real, then that individual, or is accurate, then that individual will theoretically be able to make optimal decisions as opposed to suboptimal decisions. Will be able to make the right decisions based upon not thought processes. In other words, all the things that have kept her trapped, such as, well, he expects this of me, she thinks I should do this, I want to do this, but that's not what the family wants, and so forth, into feeling and connection to spirit, making decisions organismically based upon what that person feels on a real soul, true self level. And this is, once again, ties back to if they can perceive what that true self level is and operate from that platform, choose to operate from once they identify it, then they'll be in a position to shift course and begin to make decisions organismically, to value their experiences organismically, to evaluate them, and then symbolize those experiences in their consciousness in a way that's consistent with what they really feel and what they're really experiencing on a true soul level. If you do that, then you are paving the roadway for change for this person. You're helping them move forward. And that is your job. Your job is not to see that this individual leave a bad marriage, or to find a new job, or to make peace with some child that having a strange relationship with. Hopefully that'll happen if those are the things that need to happen, but that's not your job. You don't focus on any of the items in the life. What you focus on is painting the portrait. Okay, with that said, so how do we get to the portrait? Well, let's look at a diagram. So here we have a diagram, which is essentially a diagram of the spiritual PhytoEssencing model of consciousness and existence. It's a concentric circle model, and at the center, the central circle in here, you can see is the soul. Centrifugal to that, or outward from there, we have the mind and emotional body, if we're moving centrifugally outward. And finally, the most superficial level of being is the physical body. Now, within the soul, we have the I. So this is what we'll be discussing now. Here is the I, right here at the center part of the soul. So let's go back, and we'll come back to this diagram here in just a moment. So what is the I? So the I is the immortal aspect of the soul, which journeys through the cycle of birth, death, and rebirth. In other words, if you accept the premise that you have had many lives leading up to this life. Now, this may be the culminating one. For me personally, that's my hope, that this is my culminating incarnation, that I'm done with having to be in this mortal this mortal journey. And when I move on, eventually the spirit, that I can stay there, and I can then exist, my consciousness can stay and not have to come back as you're coming back, say, more schooling, to come to some understanding that you need for completion as a soul. So if you have all these different incarnations, there's one aspect of that soul that never changes. Whether it was in 1481, whatever you were then, or 1563, or 1901, whoever you were, that I was part of that soul structure. That's not saying that the self structure was the same, the outward self structure or the circumstances of life were the same, but this core of being was the same. So the I is the core of being. The I is a distillate of divine consciousness. So you can look at the I, your personal I, this core of your being, as your personal drop of divine light. So this drop of divine light cannot operate in the material world. It's not designed to interact directly in the material world, in the same way that the transcendent aspect of the divine, that which is beyond knowing and beyond understanding, doesn't operate directly, but operates through the medium of divine light. And Kabbalah teaches it, is that there is the Ein Sof, which in Hebrew means the endless, the infinite, and then there's the Or Ein Sof, which means the light of the infinite. And within the light of the infinite are all the potentials for life on earth, and you can come to know and be connected in some way to the Or Ein Sof, to the light of the infinite, but the Ein Sof itself is unknowable, is not designed, or if you can use that term, to engage directly with the material realm. So the I, the distillate of divine consciousness, is also not intended to directly interact. It interacts through a self structure. So the self is then, in each of these incarnations, is developed, that will then enable you to engage with the outer world, with the gauntlet that is life on this mortal plane. So the first aspect that comes out from this distillate of the divine consciousness is the real self. And the real self is that aspect of the self structure which is in direct association with the I. So if you're operating from your real self, you're operating from that part of yourself which has never lost contact with spirit, with the divine consciousness. This is sometimes referred to as the inner point, the point where yourself meets God or meets the divine. So this is the part of yourself which is most informed. It's most spiritual, of course, but because spirit is infinite and contains all knowledge, if you are connected to it, then the decisions you make that are transduced through the prism of the real self are ones that are enlightened, are filled with light. So let's go back to our diagram once again. So here's the I, right here. So if you're operating from the consciousness, the real self-consciousness, directly from here, from this interface between the soul and the mind body, if you're right in this purple line here is where your decision-making process, your evaluation process is emanating from, then you are operating from a point of the infinite, of infinite knowledge. Not only of the infinite knowledge that is within the realm of spirit, but has been gained through all your past incarnations, all the understanding that has brought you to the point of where you are in this incarnation, being that they're sequential and progressive. But on the other hand, if you're operating farther and farther away from this point, out here somewhere, then you are now losing contact with this inner core of the truth. And you're now operating more under the influence of what's outer rather than what is inner. So if we look at this diagram here, this is an atom, obviously, and this is the nucleus of the atom. And what I've done here is I'm comparing this to your soul and cell structure. And this is the nucleus of the atom, which is the part of the atom that basically is the center point of its operations. I'm comparing to the eternal I, the immortal I here. And these electrons, which is what these are, and if this was a chemistry class, these are the electrons in their orbits, are the archetypes. So let's move on and see, well, what does that mean? What are archetypes and why are we interested in that? So in your past lives and through your genetics and through your early existence, the first couple of years of your existence on this plane, you accumulate archetypes. The word archetype was first established by Jung, but he uses them totally differently than we use them in spiritual PhytoEssencing. So in spiritual PhytoEssencing, the term archetype refers to a unique intangible. It's intangible. You can't touch it. You can't examine it under a microscope. You can't project it onto a screen. It's intangible. It's still something that is at that invisible soul level of existence. So it's a unique intangible construct of the soul that generates a pattern of characteristic potentials. So each of these that we see here, each of these has potentials. It's a storehouse of potentials. So let's call this one over here the potential to be adventurous, the potential to be strong, the potential to be kind, or the potential to be weak, the potential to be fearful, the potential to be a lot of different things that manifest outwardly are all in these. Which ones will express, we'll get to here in a second, we don't know yet, but nevertheless, they're all stored here. And these are storehouses of potential. And now coming back to our discussion here. So what do you actually see? You have these identifiable patterns of emotions and physical predispositions that come from an archetype. You can ultimately identify the archetype by seeing these identifiable patterns of emotions and physical predispositions. So let's give a very easy example of that. And this would be in the chakras. Chakras are archetypes. Some people are very powerfully heart chakra people. They are very emotional. They're very kind, and they're soft-hearted in a way that they're moved to tears by acts of kindness that they see on TV. They have that pattern, whereas other people just sort of sit there and watch, and they can appreciate it, but they're not reacting in that same particular way. A chakra 2 individual, the characteristic of being passionate comes from chakra 2. If a person is a very passionate individual and at the same time very sexual type of individual, since that's also chakra 2, well, maybe this individual may be a prominently a chakra 2 individual. The elements have their patterns. An earth element has to do with grounding and nurturing. So if there are lots of issues in the case about nurturing and the person is not grounded properly and feels unnurtured, can't self-nurture, maybe it's earth element that we're looking at as an archetype. So there are these identifiable patterns of emotions and physical predispositions that are viewed as tangible expressions of underlying psychospiritual archetypes. In turn, these expressions, these archetypes, that when they manifest outwardly, such as I don't feel nurtured, and because of that I'm behaving like this, I'm overeating, trying to nurture myself through overeating, I'm not really grounded, so I'm taking anti-anxiety medications because I feel like I'm very anxious, that I can't really make contact with the ground. These are the archetypal images. These are the outward images of either a success state or failed state of the archetypal pattern. And also I should say there's also the archetypal mode. If there's a way of reacting that you typically react, let's say, for instance, some individuals will hear a noise at night and go, oh, that's nothing. It's just the neighbor slamming the car door next door. And another person will say, what is that? And jump up and run for the flashlight. So your way you react, your reactional modes, will also tip you off to which particular, archetypal patterns that you have or archetypes you have. Those reactional modes are archetypal images as well. So basically, when you're looking at miasms, you're looking once again at a type of archetypal mode, or it's an archetype that gives rise to specific types of images. So what are miasms? And we've gone over this before, but I'll go over it one more time. Miasms is a concept that was developed in the early 19th century by the doctor who developed homeopathy. He was the founder of homeopathic medicine. And based upon his experience with chronic diseases, which he didn't have a good track record with, he decided that the reason he was successful in treating acute diseases, such as typhoid fever and colds and flus and coughs and things of that nature, but failure at chronic diseases, is that those long-term chronic diseases, there are miasms that are acting as blocking agent, that like a wall that he could not penetrate and get to the case. And he said they were coming from diseases from the previous generation, that the mother, the father, the grandmother, grandfather, great-grandmother, and great-grandfather, whatever, had cancer or tuberculosis. In his case, he was thinking mostly the first three miasms was syphilis and gonorrhea and skin diseases of various kinds. It's hard to say exactly what he was going with the skin disease. And they had this before the next generation was conceived. And a person with gonorrhea is going to hide that fact. Who's going to walk around and tell people, hey, you know what? I got a sexually transmitted disease. It's not something you keep to yourself. You become hidden. And eventually, if it's untreated, it starts to affect your kidneys, starts to affect the genital urinary tract in general. It could give rise to growths of all kinds, including tumors. And so you have a propensity on that level towards growths and genitourinary disorders. And on an emotional level, you're very hidden. You've got a secret. Everything you want to do is to preserve the secret. And so he said, that's the miasm. When I see that in a person, that's the gonorrhea miasm, which in homeopathy, they use the archaic medical term psychotic miasm, SYCOTIC, miasm. So basically, there other miasms have been developed in homeopathy over the years, including cancer miasm, tubercular miasm, and so forth. It's not a disease state in itself. It's basically a reactional mode that resembles the disease state, a symptom pattern mode, not the symptoms of the disease itself, but other symptoms that individual has on both emotional and physical level that a person with cancer or tuberculosis has. And so they either inherited it through this non-genetic mechanism, or they brought it from a past life. Say in a past life, the person had tuberculosis. A person with tuberculosis has a burning fire inside of them. That's why it used to be called consumption. They were burning up in some way. And they had fevers and weight loss, and they had difficulty breathing. They needed to breathe. They were desperate to be able to breathe freely. Again, they just wanted to break free, to just escape. They started to feel claustrophobic, needed to be outside, and they wanted to wander. They felt themselves dying and they needed to wander and be free. Well, you'll see that very often in people who practice in the natural healing arts. You'll run into the tubercular miasm types very commonly. This is why they're in the natural healing arts rather than having gone to medical school and gone lockstep with the dogma. They want to put together their own healing art, whatever comes to them, and they put it together into their own style of healing and so forth. And so these are what the miasms are. They're either coming from prior generations that are transmitted in some bioenergetic manner, or from a past life. Okay, so now if we go back to our diagram, and then we'll move to ginger. We see here that if there is no schism between what you really feel and what your connection to spirit and your deep feeling, your feeling connects you to spirit, and you connect from that to spirit and also to your ability to feel in an outward projected sense, then that type of wholeness is projected outwardly to the mind, to the emotions, and to the physical body, and contributes to health. On the other hand, and of course, you're also transferring the light of the soul outwardly, the light of the one. Remember, you're connected to spirit from here outwardly, so it permeates both your mind, your entire cell structure, and the physical body. But if this is blocked somehow, if this outward part of the cell structure, let's call it your survival personality, your persona, what the real self develops to enable it to be represented in the outer world while it still maintains contact with the inner realm, the inner spiritual self gives rise to a more outward self that should be under its command, that should somehow be a true representative of who you really are. But because of all the pressures of life that people are placing upon you, your mother, your father, your peer group, your brothers, the clergy, the teachers, society itself, social conditioning in general, this becomes less and less of who you are. And it becomes, when you're getting to this outward part here, either a semi-autonomous part of the self or completely autonomous, to the point that the person thinks, you know what, this is who I really am. And they don't even know that this exists here. This is they've lost contact with this. This is it. This is the world from them out here. Everything that's not out here is not real. And once you're out here, you're no longer evaluating your experiences, valuing your experiences organismically through feeling and connection to spirit. You're evaluating all your experiences and symbolizing into your consciousness vis-a-vis thought. And thought should be the end point of the knowing process. It's not the mediating point of the knowing process. It's what translates the knowing that begins here into your conscious realm. It's not the point of beginning, it's the point of full blossoming of your understanding rather than the point of initiation of your understanding. If you cut to the chase and skip feeling and connection to spirit and valuing experiences organismically and start valuing them through the ideas and conceptions and understandings of others that are not truly consistent with who you are, then basically you're going to have a schism here. And it's this schism in spiritual PhytoEssencing. The idea is that it's that schism that is where disease begins, where stuckness and dysfunction begins, because you can only operate with wholeness of being and move in a consistent trajectory towards soul fulfillment if the soul is the director of the journey. If you're directing it through the imperfect medium of your outer consciousness, you're just going to run into problems. And at least 50% of all the decisions you make are going to be wrong. And you're going to get yourself from one sticky wicket into another and never work your way down and just become miserable, which so many people live their entire existences being miserable. So the idea here in spiritual PhytoEssencing is to let's recreate this image in oils. Let's show this outer consciousness here who has gone off on what Herman Hesse referred to as the great detour. Let's show them the road back. That, hey, this is who you are over here through the blend. Let's create a mirrored image of that person here. And if they can see this here, if they can be reminded of that again, then there'll be a correction in their journey. They'll do a course correction. And instead of valuing experiences from out here, they'll begin valuing their experiences from in here. And this is going to start to heal the mind and body. And all of you by now, I'm sure, have accepted the fact that physical disease is not on a chronic level, is not a matter of just physical symptoms. The mind is playing a very huge role in that, in chronic diseases such as cancer and heart disease and Alzheimer's. The mind and body create a pattern towards unwellness if they are unwell. So as part of your role in the disease process, if you're not somebody who treats people on a physical level, is leave this treatment to, whatever other practitioners that individual is working with, the naturopaths, the chiropractors, the herbalists, whoever they're working with, leave that to them. And your job is to do this: create the image. Go back and create an image. So you can't create the image with just one oil. That's not possible. So what you're trying to do here is this. You're trying to create a jigsaw puzzle image. So here we have an image of a woman, and you can see these jigsaw puzzle pieces. And I'm just going to say this. This piece is patchouli, this piece is eucalyptus, that piece is jasmine, this piece is rose, that piece is lang lang, this piece is who knows what, Naya Uli, and so on and so forth. And each of these pieces put together creates this image. The ginger would be, if ginger was part of this individual's image, this would be it. This would be this one piece. So you have what? Just the eye and the eyebrow and a piece of the forehead. You need the whole person. So in spiritual PhytoEssencing, you are identifying what are these puzzle pieces that's going to create this image. So first you have to identify, well, what does the image look like? So when you're doing a case taking, what you're trying, and then analyzing the information you have gotten from this individual, then what you're doing is you're like a painter, a modern painter, who first takes a photograph of the person he or she is going to be painting a portrait of, and then can paint from that photograph, or at least when the person is not sitting, can refresh his memory to know, well, this is what the eye looks like, and that's what the mouth looks like, and so forth. So that's what you're doing. When we say the ginger type, we don't mean, oh, that's it, let's give this individual ginger. No, we don't. We mean we've identified one puzzle piece. Your job is to identify the rest of the puzzle pieces. So any questions before I get on to the ginger, my discussion of ginger? Okay, so let's move on to ginger now. And let's go back, and I'm only going to cover one aspect of ginger tonight, and that's going to be the cancer miasm. So I'm not going to be able to cover all of it either, but I will jump around enough to give you an idea. So ginger is associated with the cancer miasm. And if you want to know, well, which oils are associated with which miasms, go to the repertory and look on the miasms. And the miasms, I think I did this, are listed alphabetically under miasms. And under each of the miasms is listed the oils that are associated with that miasm. So you'll know right away. So basically, when you look at a chapter, and I'll go right here to the beginning first, and you go to the top of the chapter, these are all the parts of the chapter. In the sequence, they appear in this chapter that tells you, well, it's associated with the homeopathic remedy silica, it's an astral body, a spirit body, associations, fire element association, earth element, triple heater, small intestine, stomach and spleen, pancreas, cancer miasm, Netzach and Hud, and so on and so forth. It tells you. And all of these things are building one on another. They're not just separate entities in the chapter. They're basically steps along the road. They're all the roads. So, okay, I got the plant characteristics and the history, which told me something. I know a little bit more about ginger. Let me go to herbal medicine and aromatherapy. Okay, now I know some more. Let me take a look at the homeopathic remedies, zingiber, which is made from ginger. Okay, that told me some more. And on and on and on as you go, each one makes its contribution to your understanding. Here, finally, you get to the miasm point. So by this point, we already know a lot. So I'm using all this prior material to make my determination which miasm it is. I'm not just pulling this out of the sky. I'm saying, well, based upon all of this that I've studied and written and laid out and looked at and really pondered, this is cancer miasm. So now let's go back to cancer miasm. And you can see these chapters are quite long. Animalistic eating, that's a very important section. If you want to read, I'm not going to do that tonight, but that's a good one to take a look at. Animalistic eating, the person who eats animalistically, rather than in some way feels a spiritual connection to the food. In this country, animalistic eating is the rule rather than the exception. You rarely have someone who, boy, there is a lot of stuff here, isn't there? Let's get back here. I should have just, the next one will be the miasm. Okay, we'll get there. Here we are. Okay. So if you're a vegetarian, and I'm, as an adult, been a vegetarian nearly my entire adult life, since my 20s. And I'm an ovo-vegetarian. I do eat eggs a couple of times a week, but mostly purely vegetarian. Then I do have that connection to the food that there's a Hindu adage that when you're eating food, it should be like putting God into God. You have to have that understanding, that connection to the natural world and to the gift of food, especially for those people who just don't have enough to eat. But most people here, they just go stuff themselves with whatever they want without any thought or conscious connection to the food. Most of it is utter garbage that they're eating. So much of the food involves animal cruelty in bringing it to market. It's immoral to do things such as that. So you should read the animalistic eating section here and see its relationship to ginger. So the cancer miasm has two major themes. One, everything is so out of control. I need to bring things under control again, or I will be destroyed. There's chaos, a sense of breaking away, and I can do nothing. So if you see the theme of control, it's a big one in the case. So early on in life, what you will find in cancer-myasm cases, there was a lot of control in the house, generally suppression. No, you can't be this, you have to be that. No, you're not going to do that. Or there was outright abuse, that the person was afraid to even laugh in the house when somebody was an abusive individual, to bring any type of attention to herself, while, say, the abusive father was in the house. And so controlled her emotions. The suppression was not so much understood as much as it was a repression in response to fear. So the suppression was actually a type of repression at the same time, a type of control myself. Don't react to whatever he says. That's okay by me. Don't play into into his wheelhouse, which is going to be, he wants you to contradict. So he has the excuse to strike back in some way. But if you're just sort of dodging and being strategic, it sort of perplexes that individual to a certain extent, that you can maybe walk between the raindrops as much as you can. So you end up with this theme of control. And the paradoxical thing about this is that you would think that once the person is out of this domain and is out on her own, living away from the abusers and controllers and so forth, you would think now, oh man, now no more control. This is great. No, it becomes imprinted. This is the last constitutional influence, is childhood. Once you're out of childhood, there are no further constitutional influences. Anything that happens to you after that is experiential. It could be highly traumatic, but it's not constitutional. But this is constitutional modeling that takes place. So now that you are in this domain of control, you need control. And since there's nobody around to control you anymore, you control yourself. And you have a fear of loss of this control. So you do whatever you can to maintain control in your life. And anything that seems risky, like being who you really are, as opposed to persisting with the masquerade that has worked for you and gotten you by in your life and enabled you to get through college and get your job and so forth, you don't want to give that up, because that means a loss of control. There's this fear of chaos, that things will break away and you won't be able to do anything about it. And of course, in this process, you have no chance whatsoever, ever performing or acting from your real self, from that core of being. You now are locked in this particular mechanism. So you can see how this resembles a person who has cancer. Everything is so out of control, meaning the cancer cells. Cancer cells, my goodness, it's out of control. Is it benign? I hope it's benign. I hope it's certainly, I hope that when the pathology report comes back, that it's benign, that it's not malignant, because it can go out of control and I'll be destroyed. And there's chaos inside my body now. I don't even know my body has betrayed me and I can't do anything. I have to do what they tell me. I have to take this chemo and lose all my hair and vomit for months and lose weight and become a skeleton. Right, exactly. That's what happens in cases that are not properly managed and that become a disaster. It becomes just that. Now, the other theme is the inability to develop a sense of individuality, which I've already basically explained that, but you can't separate yourself from the masses. Who am I? Who am I and how am I not like my sister or my brother or, all the kids in the class, how can I be just me? I can't manifest that. I'm having a problem. I can't. There's a malignant inability to differentiate yourself from other people, and you cannot or do not allow your individuality to be expressed. So you go around and you perpetuate the masquerade. And the problem with this is that the masquerade generally begins when you're young. And when you're young, we were all there at one time, you're healthy, even when you don't eat very well at all. Everybody knows about eating pizza at midnight and having the crusts for breakfast the next day and still being able to do a lot of stuff. Where if you do that now, you're going to be in bed if you're lucky. And so you can do things. You can party all night and go to the beach the next day. You have all this vitality. You have your youth. You're generally in much better shape. You're physically are in much better shape. Your mind is sharper in some ways. You have much more stamina. You're not as easy to fatigue, and you're better looking. As you get older, you're definitely not as good looking as you were when you were young. So forth. That's just a natural process. But that stops when you get older. Now you're starting to get tired. You can't do all those things anymore. You don't really look as good as you used to. You don't have the various strength and focus to be able to do all the various strategies you had to get by when you're younger. In other words, you have now entered your failed stage. That masquerade, that persona, that outward self has moved from a success state when you were 22, 24, and now you're 48. It's failed. It's not working anymore, but you're stuck. You cannot allow yourself to differentiate. So now you're stuck in this repressed state, and it doesn't even work anymore, but you can't get out of it. So de-differentiation is a term in physiology and pathology of what happens with cells. So let's just take a quick look at that, and then let's go back to ginger. So the combination of these two themes of everything is out of control and the inability to develop a sense of individuality is clearly reminiscent of the actual cellular pathology associated with cancer. So the first one I discussed was with metastasis. The second one has to do with the process of de-differentiation that may occur in some cases. So let's just discuss what differentiation and de-differentiation is, because it's something you should know. So this involves the regression of specialized cells. Let's say a breast cell, which was a specialized cell, a breast cell. It regresses to a tissue that is simpler and more embryonic, an unspecialized form, no longer a specialized breast cell, but something in between, an embryonic cell and maybe something that resembles a breast cell. This process that takes place as a person becomes more and more diseased is referred to as de-differentiation. The cells are de-differentiated. So differentiation is the process which begins in the developing embryo, during which time primitive unspecialized cells change in form as they multiply into different specialized cells required to constitute the various organs of the body. So all these embryonic cells become lung cells and brain cells and heart cells and so forth. So that's differentiation. But if you develop unwellness because you don't do the right things in your life, 90+% of all chronic diseases are due to what you do wrong in your life. They don't hit you like a lightning bolt in a clear blue sky. They develop over decades of doing the wrong things. So first you have the excretion phase of disease, and the excretion phase is, okay, my body's doing the wrong, throwing all kinds of the wrong things into me, and I have to excrete it. If that is successful, then you go back to being normal. In most cases, it's not. because the level of junk that people take into the bodies is beyond the ability for the body to fully, effectively excrete. Okay, well, you couldn't do that. So what can we do next? Okay, let's do inflammation. Let's do inflammation, have all the white blood cells attack all these toxins, try to break them down, stimulate excretion, bring oxygen to the air, and let's get this stuff out of here. Okay, let's try it. Well, you're still eating all the same garbage, so you're having more garbage coming in. You're putting chemicals on your skin. You're putting chemicals on your hair. You're doing all kinds of things synthetically to yourself, and more toxins are coming in. Your total toxic load is very high. The inflammation can't keep up with it. And so the inflammation just keeps going and going, like a motor that never turns off, like a blender that just keeps going until the engine, the motor on it starts to burn. And now the inflammation becomes part of the problem. Okay, the inflammation failed. So what do you do now? Okay, I've got an idea. Deposition phase. Deposition phase means we couldn't get rid of these toxins. Let's put them in closets. So where are those closets? The blood vessel walls, your joints, in the spaces between the cells, known as the extracellular spaces, stores toxins. It's like you go into somebody's house and they ran out of shelves and they just have a bunch of junk and it's all over the floor and here and there and books and clothes everywhere that you can look. And that's what starts to happen inside the body. And that's called the deposition phase. Okay, we're containing it. We got it in the joints. We have it in the blood vessel walls, but the heart is still able to pump. The kidneys are still able to excrete. The lungs are still able to breathe. I'm alive. So what's happened here now is your lifespan is continuing, but your wellness span has long ceased to be active. Your wellness span is over. And you need to measure your life in terms of your wellness span, not your lifespan. Because if you're sick for the last 40 years of your life, what's the use of that? Who wants that? What's the value of that? Just to be on 9 different prescription medications and be a complete, to use a Yiddish term, kayaka, which is just sort of a broken down, debilitated individual on all these medications with side effects, but you want to be as healthy during those times. Okay, so now the deposition phase has failed because you continue to throw garbage into your body and it's beyond you ran out of places to deposit it. So now the extracellular spaces, which have been trying to control and keep all this junk out of the cells, the 50 to 100 trillion cells you have, trying to keep it out. Because once it gets into the cells, you're in deep trouble at that point, really deep trouble if that happens. Because if it gets into the cells where your DNA is, it's going to start destroying or damaging your DNA in your mitochondria and in your nucleus. And when you start producing new cells, they won't be normal. Because you need that DNA, that's the blueprint for making the new cells. From the old cells, once they wear out, they have to be replaced. Sometimes as soon as every 1 day. Sometimes it's weeks, sometimes it's months, sometimes it's years, according to which tissue it is. So now you're destroying your blueprints. You're producing abnormal cells, and they're de-differentiated. Instead of producing a fully differentiated cell, as you did when you were an embryo, into a normal lung cell or pancreatic cell, you're now you're going the other way. The boat has turned around and it's sailing backwards to lesser and lesser stages of differentiation. And this phase is called the de-differentiation phase. And de-differentiation phase is associated with cancer. So this is where the connection between the miasm of differentiation, the cancer miasm, and the whole issue of differentiation comes in. So with that said, let's go on back to discussing ginger in particular. Now, obviously, I'm going off on a lot of tangents here that I feel are important for you to know. Just hang on 1 second here, please. Okay, I just feel it was important for you to have these understandings of things. And sometimes I don't cover as much material as I should, because I feel that the basics of understanding are more important than the specifics of certain topics. So let's take a look at the common emotional symptoms and characteristics of the Cancer miasm individual. Okay, so some of these are pretty universal in some ways, and you're not going to be able to really identify the Cancer miasm through some of these symptoms. For instance, excessive fear and apprehension. Okay, you see that in the acute miasm, you see that in the typhoid miasm, you will see that in the psychotic miasm, you will see that in the syphilitic miasm. Doesn't give us much of anything. Melancholia, which is an old-fashioned medical term for depression. Again, doesn't tell us much, but it's good to know that it's part of the Cancer miasm. Fear of death, you'll see that in other miasms as well. Again, not really telling us all that much. Fear of disease, a little bit closer. Despair of recovery, you will see that in the psychotic miasm. So once again, it's not telling us this much. So what are some of the really the symptoms or characteristics that will lead you more? Symptoms worse at night. Symptoms worse at night. And when alone. Symptoms worse at night and when alone. Symptoms better in company. Contradictory states of mind and body. Of two minds. I want to do this, but I don't think I should, because, and it's always the same thing, because he expects this of me, or they're expecting me. My mother-in-law wants me to do this and be there and help cook, all the rest of this type of thing. It's a contradictory states of mind and of the body. I'm cold, but but at the same time, I'm getting hot flashes, but then I'm chilly. I'm tired, but sometimes I can't slow down, and I can't go to sleep. My mind. So there's these contradictory states of mind and body. The person is passionate. They tend to be passionate. The truth of the matter is you are going to see a lot of Cancer miasm types who want to study spiritual phytoessencing. I'm sure some of you have now remember, just like the oils are jigsaw puzzle pieces in a person's portrait, the miasms are too. You can have more than one miasm as to who you are. You can be a Cancer miasm plus typhoid miasm, or Cancer miasm plus psoric miasm. Generally, there'll be about two that are ones you really want to look at. That there's going to be about two, maybe three, but two is where I'm focused. So I'll say, okay, Cancer miasm, and she's also typhoid miasm. So, but many of the people you'll find in Spiritual PhytoEssencing have a predominant or very strong Cancer miasm root in their archetypal picture. The sense of being unfulfilled. This is very big. The sense of being unfulfilled. They work excessively. Somehow, the individual comes to the idea that if I keep working and trying and really working, I'm going to work my way out of this. I'm going to get to something better. No, you don't really. All you do is get tired from that, and it's not going to get you to where you want to go. So what's another idea the individual will have? Desire for travel and excitement. Okay, I'm gonna go to Provence. I'll walk through the lavender fields, or I'll go to Italy, and I'll stay out in the countryside of Italy, and it'll be great. And so for of course the 10 days of the vacation in Europe are over, and that's over. But there is another miasm that has a desire for travel, and that's a tubercular miasm. The desire for travel into tubercular miasm, and this is how you differentiate it, is the desire for romance in some way. So if you've ever watched this old, sort of simplistic show, but entertaining in its way, The Love Boat, that's a tubercular miasm show. Virtually every guest star who walks on the ramp onto that boat is looking for romance in one way or another. Their desire to travel on that boat was to find somebody and to have a romantic experience in a romantic place like Acapulco or someplace in Europe or so forth, tuberculous. Cancer no, that's not it really. They're going to Provence for the lavender. They're going to Italy to see the ruins and the history, and to taste the Italian food and to experience Italian culture. It's a much more intellectual feeling. The excitement that they want to feel is to learn, to understand, to grow, to evolve in some way that they can't do in their everyday life. So there's an old expression, I believe it's from the Hindu culture, which is, if it's here, it's everywhere. If it's not here, it's nowhere. This idea that you need to go somewhere to evolve, to find the excitement that helps you grow, is contradictory to that understanding. If you're operating from your real self, every day is a day of learning and understanding. Ailments from domination by others. This is a giant piece in the Cancer miasm. Absolutely a giant piece that if you don't remember anything else that I'm saying, like symptoms worse than that, you don't really have to remember that. You can just look in the chapter for that. But this is one that you should keep in your mind. Ailments from domination by others. Here's another big one. Sensitive to admonition, meaning sensitive to being reprimanded or criticized in any way, even if it's very polite, constructive type of criticism, they'll take it in bad part. And of the Cancer miasm types, the oil for which you will see this at its height is patchouli. Patchouli, this is very big in the patchouli type. They take things personally. Even if it's a criticism like, you know what, I think you should have centered that picture on the page. And someone go, oh, thanks, But, well, I thought it should be on the, and take it personally. But they are very sympathetic. They will be moved to tears by some, moving type of story that they hear on the news, or something that's really terrible that happened on the news. And you have to be careful about watching, they have to be careful about watching those type of things, because it's not good for them to be oversensitive and overly sympathetic and have anxiety for others, even if they don't know those people, because it's going to wear this individual out emotionally. They'll become exhausted from being over emotional. They're sentimental. They long for a time that is not now. There is romanticism, but this romanticism is basically a true romantic feeling. It's not, although there could be some strong sexual drive involved with it, the sexual drive has got to be linked to the romance, and the romance has got to be real. It has to be something real, not something fly by night. They feel neglected. And you'll often hear this of Cancer miasm individuals who are married. The husband is not really paying attention to them as a person, just as the wife, the partner, or whatever. And the kids, after a while, don't pay attention either, because she doesn't have a high degree of respect for herself, doesn't value who she really is to the level she should. Why should they? So she becomes a non-entity, a cog in their lives, rather than a presence, a unique presence. Despair of being unloved. All of these things you can see follow from one another. A passion to read. Through the process of learning, not only are they escaping, but this is their only way of growing and developing, because they don't allow them to do any other mechanisms for that in his existence or her existence. But yet there's a strong sense of duty, and this develops from childhood. Yes, the father is this, and the mother was that, and the brother was this, and all the rest of this. But yet, when somebody gets sick in the family, or some crisis is going on, she's the first one to jump in the car and drive 500 miles to see what she can do to help the situation. These two are really pivotal. Love of animals. They love animals. Any animal, really, on TV mostly. They're not going to hang around with bears. But cats and dogs, they become the mommy to the cats and dogs. You don't have to worry about the cats or animals being mistreated by a cancer-mycin type. They become family. As a matter of fact, more loved than family, and they reciprocate more freely because the animals, not thinking of you on that outer self level, are able to connect with you on that inner self level, because with those animals, that's the only experience you have of your inner self. That's the only time you allow yourself to feel from that core of being. And the animals can feel that. And they return that from their core of being. And the bond becomes much stronger sometimes. A lot of the women that I have developed blends for have a much stronger bond with the dog or the cats than she does with the kids, especially as they grow up and start going off into the tangents that are part of modern life, which are very difficult to understand sometimes. And here's one that's very baffling if you don't really understand it. Love of dancing. They love to dance. They'll get up and dance, And I've mentioned this anecdote before because it really took me by surprise as well. And I did a blend, and I had noticed that for every cancer miasm individual that I had interviewed and was doing a blend for, sure enough, they love dancing. I said, now this can't be true of all of them, right? There's got to be some exceptions to this rule. And I was doing, there was this a woman, she was in her 30s, and she was a really nice Puerto Rican woman from the Bronx. And she was a Jehovah's Witness. In her spare time, she was going around doing witnessing and, giving out the Watchtower magazines and all the things that annoy a lot of people. And so I said, this one is definitely, I know she was a cancer miasm and from everything that was in the interview so far, this is the exception. I'm just going to ask this question, but I know she's going to say no. So I said, just out of curiosity, do you like the dance? And I fully expected the answer, no. And she said, oh, I love to dance. And that's what I do in my spare time. I do ballroom dancing. And not only do I do ballroom dancing, but the ones she loved to do the most were these really sexual type of dances like the samba and the rumba and the tango. So you will find love of dancing in cancer miasm. But this doesn't mean that it has to be Ginger Rogers that you're dealing with. They could just, it's just to themselves and nobody's around. They like to move around. And why? What is this ultimately? What is this? This is another form of expression of who she really is. This is a form of expression of the passion, of the sense of being unfulfilled, of the desire for the excitement and the separation from the self. Infertility. This is a very interesting word, infertility. Does it mean infertility in terms of having children? It could, but most of the cancer miasm women that I have done blends for, it was not the case. It's infertility in their lives. Their lives are just not fertile. They're not creative. They're not able to create. There's this sense of being infertile on a soul creational level. Now, history of tonsillitis, sometimes you'll see that. Never well since mononucleosis, you'll get that. Like 1 in 25 cases, you'll get that. But here's another big one that you're going to get in virtually every case. Desire for chocolate. And there's nothing wrong with raw cacao. It's a good food if they can tolerate it. But what they like is that chocolate. And chocolate, of course, has this reputation of being for people, or chocolate addiction, for women who have experienced unrequited love. In other words, they're putting out, but nothing's coming back their way in terms of love. They're trying to give love, but there's no echo coming back towards them. So chocolate somehow appeases that particular sense of loss or lack of fulfillment, of being unfulfilled. So these are some of what you'll see in the Cancer miasm. Now let's go to ginger. So here are some of this is how you start to see how I'm piecing this together. So some of the qualities that you see in the ginger oil picture are kind, accepting, affectionate, and shy, prefers stability to uncertainty and change, melancholic, thoughtful, contemplative, considerate, highly creative, but somehow they repress that, perfectionistic, control, and prone to preoccupation with the cruelties of the world, very private and withdrawn, with a tendency towards non-specific sadness, yielding, refined, mild, delicate, with inner resistance. So you can start to see how I'm being led to the Cancer miasm from some of the qualities in the ginger oil picture that preceded my writing of the miasm section. Okay, so there's a lot of more detail here, and I'm just going to read one or two more paragraphs, and then we're going to move on to one other discussion for tonight. Her sense of fragility and need to protect self-image makes her very sensitive to criticism and feelings of neglect or humiliation. She often will report a history of setting aside her own needs for those of the partner or the family group, that there was insufficient privacy and opportunity to pursue her own yearnings. This can lead to the cultivation of a sense of victimization, having provided dutiful service without acknowledgement or reward. In turn, this can encourage feelings of low self-worth, the belief that she does not deserve anything for herself. So the silica ginger type, because silica is part of the ginger picture, firmness, fixity, and preservation of the image she wishes to project are the mechanisms required for her to stand firm in the face of life's assaults and remain intact. In other words, the image has to be preserved. However, in the failed state, when this is no longer working, when that ability, the capacity to maintain that image and hold off the assaults of the world has failed, as you get older, inevitably, she's not able to maintain these barrier functions, and feeling extremely vulnerable, her natural tendency toward timidity, self-consciousness, anxiety, irresolution, and hypersensitivity are greatly magnified. So you're beginning to see now who is the ginger type within the context of the Cancer miasm. So I'm going to skip down here a bit, see if there's anything else I want to talk about here before I end this discussion. And this is where we'll end this. In the Cancer miasm individuals, there's often a history of high expectation by the parents. Oh, you have to go to college, get an advanced degree, you got to be a doctor, a lawyer, an accountant. There's excessive parental control, suppression and or abuse during childhood, strong, deep attachment to the family, even if they are oppressive. They're still attached to the family. The person is trying to be perfect, and in so doing stretches to the limit of her capacity and has no rest or freedom from tension. Okay. So this is the last place. This is where we're going to stop with ginger. And then if you want to read more of this, you'll have to read the chapter. The ginger type, which is the specific for chilliness, the ginger type is chilly, may have experienced the overt forms of suppression described above. However, this is often not the case. Instead, the suppression is commonly not exerted by individuals such as the mother or father, but rather by circumstances, such as childhood illness. In other words, she had polio, and so she had one leg which didn't really develop that well, and she limped. Or as a child, she was overweight, or had acne, or something of that nature. Interparental conflict. there was a lot of fighting in the house between the mother and father. And this led to a type of suppression where she didn't want anybody to know about it, what was going on in her house. An estrangement or an upbringing immersed within the confines of rigid religious boundaries, which would also create this suppression. Okay, so this is what you're looking for in the ginger type individual. And it goes on, but we don't have time to cover all of it. So if you want to read more and get more of a feeling for ginger, I suggest if you don't have chapters, get ginger and get another chapter that has to do with the cancer miasm, like patchouli or lemon. And then you'll be able to see how you can differentiate one cancer miasm individual from another. How you can determine, well, it's cancer miasm. How do I know if it's ginger instead of lemon or patchouli instead of Roman chamomile? How do I know? Well, get another chapter, compare it, and you'll see how it's done. Okay, with that said, are there any questions?